The pulmonary function testing during SARS-CoV-2 position statement was commissioned jointly by the Thoracic Society of Australia and New Zealand and the Australian and New Zealand Society of Respiratory Science.
SARS-CoV-2 is transmitted by respiratory particles, both droplets and aerosols. Pulmonary function tests generate respiratory particles through forced manoeuvres, high ventilation, and also coughing. Protective measures are required to protect the health and safety of healthcare workers, patients, and visitors who attend for pulmonary function tests during the COVID-19 pandemic.
For a quick guide to the key messages, the pulmonary function testing workflow controls diagram gives a concise overview. All pulmonary function testing should be performed in a COVID-19 safe environment. This includes adequate room ventilation of greater than 12 air changes per hour. Healthcare workers should be trained in personal protective controls, including mandatory fit testing and fit checking for the use of P2 and N95 respirators. Observing physical distancing and density limits in rooms and waiting areas. Healthcare workers should be vaccinated against COVID-19, and healthcare workers should not attend work when unwell. When the test request is received, it should be prioritised as per organisational guidelines. Alternatives such as home-based spirometry, minimum testing for clinical decision-making, and test modification or substitution may be considered. The patient should be screened with a pre-test questionnaire and postponed or deferred if high risk or COVID-19 positive. Screening such as rapid antigen testing or PCR is recommended. Vaccination status and immunocompromised status should be considered. During the test, the healthcare worker should use personal protective controls. There should be a single patient for each clinic room and physical distancing should be applied. Inline filters should be used. Cough etiquette should be encouraged. After the test, high-touch areas should be cleaned, non-disposable equipment should be cleaned, and the room should be empty between tests to allow for ventilation. For a detailed summary, please see the Key Messages section. The position statement contains information and evidence assessment of these recommendations.